Hey, I hope you enjoyed that last video and thanks for joining me on this one. On this little snippet, we're going to be talking about proactive care versus reactive care. And so most of the time we are living in reaction. We have the symptoms and then we go and get some help. So the symptom is already there, that means the problem is already there. In the last video, I showed you how the central nervous system sends signals from the brain through all the nerves to all of our bodies. So when we have what we call a subluxation, now you know what a dislocation is, when a shoulder or knee dislocates. A subluxation is when our spine misaligns from the one above or below due to falls, due to accidents, and most of the time it's just repetitive stress. Okay, so that's exactly what we see here. In our spine. These are all healthy. I'll show you some other pictures and we'll pop some in of misalignments and subluxations. But you can see that the brain has a central nervous system and those nerves go out directly and indirectly. This is the sympathetic or the autonomic nervous system, and it controls the lungs, the heart, and all of these other organs that we have. Now over time, when we have subluxations, not only do we have pain such as headaches and migraines, neck pain, upper back pain, and low back pain, but what people don't know and people don't relate is that same area could be giving you lung issues, inability to repair from things like asthma, bronchitis, yearly sickness. All of these things that keep reoccurring and you just never get better could be a central nervous system problem. So what we look forward is being proactive. If we could keep your spine clear, we can keep your organs functioning at their best. Now, my kids do get sick, and so do I, but when we have the flu or we have this, it doesn't last long like other people do for months or several weeks. Ours is about a week, week and a half, and we're getting back because our clear nerve system allows us to have better function and repair faster because the brain and the body communicate well. So you can see somebody that might have forward head posture would get a lot of headaches. Now most people think headaches and migraines are happening in the brain. They've gone to neurologists over the last 20 years. This neurologist, they do scans, they have no idea. Most people don't know. 90% of migraines happen right here at C1 and C2. Right in this pressure, just due to a misalignment. And it could happen really at an early age, but the symptoms come later. So always understand, when you're having a symptom like neck pain or low back pain, might have been caused by an injury that might have been sudden, or just showed up out of nowhere. Those are even worse, the ones that show up out of nowhere, because the ones that show up out of nowhere kind of tell me that you've had a problem in your spine sitting there brewing, waiting for the time to come and get you and cause an issue. So when we have people just suddenly, hey, I just started getting acid reflux. That's so common. Why? Because everybody's sitting on a computer and they're sitting hunched and all that pressure goes right in there, and those nerves affect the digestive system, and suddenly at 35, 45, 25, they can't eat the foods they needed to eat in the past. So again, now we have a spine that has subluxation and it's causing this. Now, reactively, you're gonna throw some Tums, and if that doesn't work, you're gonna go to a purple pill, and if that doesn't work, you're gonna keep going to your doctor and addressing all these things. Because one of the things that happens is when our nerve system goes out of line, one of the biggest things that happen later on is blood pressure, right? The central nervous system controls stress and it controls all the arteries right here, blood vessels, right? So the constriction of blood vessels gives us a higher blood pressure, controlled by the nerve system. So you can do your salts and you can do your medication to take down your blood pressure, but you're really not fixing the problem. You're covering the symptoms. So imagine this, you have a car, right? And your car that you're driving, your check engine goes on. Do you just stick your hand in the glove compartment and get out a piece of that electric tape and stick it on your check engine and keep driving? No, you wouldn't do that. Well, some people would. Most people will take it in and get it checked out. They know something is wrong. Our body's check engine light is things like asthma. It's things like digestive issues, constipation, anything that could go on. And again, I don't treat any of those. My main focus is making sure that the spine is clear. So when you have a check engine light like headaches, when you have check engine light like back pain, it's your body telling you something is wrong. When you're having constipation or diarrhea, it's your body telling you it's out of order. When you're having heart palpitation or blood pressure issues, it's your body telling you you're not in function. When you're having migraines, when you're having dizziness and vertigo, it's your body telling you that something is not right. Now, 97% of our populations goes and takes some kind of drug or medication to cover that up. That's no different than the electric tape on the check engine light. Our proactive way is, hey, how could we be in front of your health instead of chasing your health? And so a lot of our patients, and you might be one of them too in the future, that get regular maintenance care. We have whole families. You're going to see children in here. Hey, doc, why are you adjusting these kids? On the next video, I'm going to talk about spinal hygiene and dental hygiene. And when do we usually start dental hygiene? Do we start in our 30s and 40s when we have cavities? Or do we start from almost 5, 4, or 3, teaching our children how to brush their teeth and keeping them clean? Well, if teeth are important, isn't your nerve system? We'll talk about that soon. So our goal here is to get you out of pain as soon as possible. That's our first thing. And we know within our first month of our corrective care, we get people out of pain. Some people even sooner if it's an acute problem. Long term, our goal is to restore your spine so you don't have this come back. So that's 2 things that we're going to be focusing on while we are taking care of you in our corrective or pain relief game plan that we have for you. So just that you know, understand if you're here in our office with back pain, I'm concerned about the back pain. Now, the pain might go away, but the problem might linger and start showing up somewhere else. That's a concern. You might have upper back pain that might go away, but respiratory or common colds and bronchial issues will keep reoccurring. That still comes back to the spine. So everything that you see and everything that people take medication for, there's a huge function that comes back to the nerve system. So by no means am I saying I'm going to fix everything. What I am saying is if your spine and your central nervous system are stress-free, the chances of you living a higher potential and healthier potential are greater. We keep in the future, you reduce arthritic changes, you reduce bad posture, you reduce things like osteoporosis and degenerative disc disease by staying under chiropractic care and making sure that your spine is healthy. So this is a huge part of our practice. Our goal here is to be in front of the hockey puck, not chasing the hockey puck. We're not here to chase your health. We're here to restore your health and teach you how to take care of yourself and really stay in front of your health by making sure that your spine is subluxation free, that it's strong, it's got these beautiful curves that it needs. We'll be talking about that, or if we haven't already, these curves are really important to the spine. So it's up to you whether you want to pay proactive or a reactive role in your health. I love yoga. Yoga's great. I love doing Pilates and exercising. These things are fantastic. These are supports to keeping your spine, but I haven't seen a drug and I haven't seen any kind of exercise that will realign and remove the subluxations from your spine. So those are facts. I've had people do a lot of PT, and in our office, in our phase 3, we do implement PT because strengthening is important. But at the beginning, nothing's more important than correcting the framework and the alignment of the body. want to thank you for this presentation. We're going to go and talk about hygiene, spinal hygiene, how to take care of this at home. We just said a couple of things about it today in this little video, but the next little video I'm going to talk more about how to have spinal hygiene and how to take care of yourself. Thanks for joining me. Click over here or here. I'm not sure where they'll put it, but the next video will be right up.